Hello, NCLEX Crusaders! Welcome to NCLEX Crusade International YouTube channel. Welcome to day 4 of our 7-day training, Pass the NCLEX step by step. So here's the agenda for our 7-day training. We have already accomplished a lot. Day 1, we talked about understanding the NCLEX world. Day 2, we talked about NCLEX categories. Day 3, yesterday, we talked about other NCLEX categories. And today, day 4, we're going to talk about the last NCLEX categories. And of course, we are going to practice several questions. So you can continue improving your critical thinking. You can continue to learn how to analyze NCLEX style questions. I want to share with you the topics that we will be discussing today, day 4 of our How to Pass the NCLEX Step by Step 7-day training. So the two categories that we will discuss today, one is health promotion and maintenance, and the second category that we will discuss is psychosocial integrity. And of course, for each category, we will practice some questions. I think that we're gonna finish a little bit earlier today. I hope so. And at the end, I want to give you guys an open Q&A session. So each one of you that want to join us and stay until the end, at the end, I will open the Q&A session and I will allow you to ask any questions that you may have about NCLEX preparation, anything that you want to ask me, our academy specifically, and I'll try the best I can to answer each and one of those questions. So it's gonna be very interesting on this day 4. If you remember, since we started talking about the distribution of content for the NCLEX RN accordingly to the test plan that the last revision was done in 2019, we talked about different categories that you will encounter in the NCLEX. And today, like I said, I will focus on health promotion and maintenance and psychosocial integrity. So let's begin with the first category, which is health promotion and maintenance. In order to demonstrate that you are a safe and effective nurse in the health promotion and maintenance category, you have to provide and direct nursing care of the clients that incorporates knowledge of expected growth and development, prevention and early detection of health problems, and strategies to achieve optimum health. I will tell you this, in this category, the health promotion and maintenance, a lot of the questions in this category has to do with teaching, education. So I will give you some tips this afternoon, this evening, about patient education. And the questions that we will be reviewing is going to be about that, patient education. So here are the topics that are included inside health promotion and maintenance. Thank you, Mr. Martinez, always supporting our channel, donating for our channel. Thank you for that super sticker. And welcome to NCLEX Crusade International. I appreciate it. So the subtopics that are included in health promotion and maintenance provide care and education for the newborn, infant, and toddler clients from birth through 2 years. Provide care and education to the preschool, school age, adolescent, all the way through 17 years old. Provide and care education for adults, prenatal care, postpartum care, assess and educate clients about health risk based on family, population, and community characteristics. Perform targeted screenings, assessment, as an example, vision, nutrition. Assess the client's ability to manage care in home environment and plan care accordingly, and a lot more. So there's a lot of information in the health promotion and maintenance category. Thank you Gelmarie Archibald, for supporting our YouTube channel. Thank you very much. The goal of patient education. What is it? What is your goal as a nurse when you are providing education, when you are providing information to your patient? Well, the first goal is to inform patients and deliver information in an understandable way. And also, before you provide that education, you have to determine their level of health literacy. What are you talking about, Professor Ray? Whenever the nurse is communicating with the patient, you should avoid the legal jargon. You have to avoid the technicalities in the communication. You see, your patient does not know what positive or negative troponin levels are. You have to speak in what is known as layman's term. Simple communication so they can understand the instructions that you are providing as a nurse, educating them. Before you give education, it's very essential that you complete an assessment and determine if the patient can understand the education that you will be providing. An example of this, how about finding out what is the language, the best language that the patient can understand? If it's a Latino person, are you going to communicate in Spanish or English? Are you going to provide a translator? So that assessment, it is very important. The more understandable the health information is for the patient, the closer the care is coordinated with the client's needs. In other words, the better your communication, the better your teaching, it will be the best technique to provide appropriate care for your patient. Now, let's talk about setting priorities when it comes to education. Rank clients' learning needs according to importance involves client in ranking needs because learning is more likely to occur when clients' perceived needs are met. In other words, let's say your patient is in pain and you will be providing education. What do you think is better? To start teaching the patient about XYZ topic and then take care of the pain, or would it be better if you alleviate the pain first? What if you give pain medication first, control the pain, and then wait a few minutes and talk to the patient or teach the patient later on? That is what setting priority means. Use appropriate timing. For example, a client with diabetes is more likely to successfully self-administer insulin immediately after watching a video than in comparison to the next morning. Or let's say you provide a teaching to the patient about how to self-administer insulin. What is the best moment to have the patient try it out? That second, you teach the patient about how to self-administer insulin. You ask for feedback. Did you understand? Do you have any questions? And then you tell the patient, go ahead and try it. Give it a shot. And after the patient completes that administration of insulin, give feedback once again and say, great, you did this right, you did this incorrect, and teach the patient. Remember, you are responsible. If you are the one providing the teaching, you cannot delegate the evaluation of that teaching to someone else. That is extremely important, and that is an NCLEX tip for education style questions. Thank you, Ms. Ana Lacey Perez, for supporting our channel. Thank you very much. Same with Alexandra Troncoso. Thank you, Alex, for sharing with us, for donating to our YouTube channel. I appreciate it very much. Lastly, organize material. Remember that learning occurs from simple to complex. Organize material in a manner that allows the learners to assimilate the information. So do not begin with the more complex subjects. Start with something easy and evaluate step by step the patient's understanding. And as the patient continues to understand, cover more complex information. So what I want to do now, I want to share with you our first question, and I want you to think about these guidelines that I have shared with you. As you review this question, look for keywords. Find the 5 key factors of an NCLEX question. Identify if this is a content question. Is it a prioritization question? Is it a teaching question? And what is the best answer? And then, after you have understood the question, you've reviewed the question, go ahead and comment your answer in the comment section below. Tell me what you think is the answer, and most important, why. So what I want you to do, let's say you think the answer is, I don't know, 3. You put 3, comma, this is my reason why. If you think the answer is 2, you type 2. This is my short reason of why. I want to see, I want to read where your thinking process is at. Thank you, Nancy Nemo, for supporting our YouTube channel. Thank you very much. So this question states, a nurse is evaluating a client's ability to change the surgical dressing before discharge. So first keyword that we encounter here is that the question is about evaluation of the patient's ability with regards of surgical dressing change. So the core of this question is about teaching, but evaluation of teaching. It says, during the demonstration, the nurse notices the client has not performed the procedure correctly. In other words, the nurse conducted an assessment and she noticed. This word, notices or noted, means that the nurse completed or started doing an assessment. And what she found out is that this patient did not perform this procedure correctly. What is the most appropriate action? What this means is that there could be more than one appropriate answer, but you have to identify what is the most important one. So, read the question, read the answers, and find out of the 4 answers, which one is the most appropriate. Thank you, Ms. Dayanara Pacheco, for supporting our channel. Thank you very much. Thank you, Mr. Gerald Arado. That's my brother. Thank you for being here and supporting your brother's YouTube channel. I appreciate it. Ms. Gisela Dueñas, thank you for being here and supporting our channel. And Yusel Nunez, once again, you've been supporting our channel every single day. I appreciate it. Thanks for your kind heart. All right. So as you can see, we're getting on day 4 and the questions are starting to get a little bit harder. I can tell by the variety of answers in the comment section. Before day 1, day 2, day 3, we covered more basic questions and almost everybody was selecting the correct answer. But as we get to the end of this training, the questions, they will be more difficult, especially day 5 and day 6. So we're gonna start presenting more difficult, challenging questions so you can continue improving your critical thinking. So I see some of you are responding 1, some of you are responding answer 2, 3, 4, All right. I see the Dream 83 says 2 because you need to show what are the correct steps. Excellent. Mr. Rolando 4, give feedback. Excellent. Let me see, Miss Emily 2 because I will show what was wrong. It will show what was wrong. Or 4 because I want them to try to see where they're wrong. So I see some of you are in between 2 and 4. If that is the case, if you're in between 2 and 4, listen very carefully. If you selected the correct answer. All right. So let's dig in. Let's go into further detail. Application of critical thinking. Answer number 1 says, so think about answer number 1. And some of you selected answer number 1. So let's say the patient did something wrong during the procedure, and this is your action. Immediately, change the dressing again to demonstrate the correct technique. Imagine that you're the patient. You try doing this surgical dressing change. You do the best you can. And the next step of the nurse, without talking to you, without explaining to you what was right or wrong, immediately start changing the dressing, change without saying anything else. Do you think that is an appropriate action to make? That is not an appropriate action to make. There is no education or, important word, feedback performed. Remember, the order of teaching is you teach, you validate the teaching, you request the patient to attempt it, and then you have to provide feedback and reteach if something was done incorrectly. That is very, very important. Thank you, Ms. Denia Sanchez and Ms. Erinea Montero for supporting our YouTube channel. Thank you, Elizabeth Saldana, for supporting our YouTube channel. So answer number 1, I think we can take it out of the way. We can eliminate answer number 1. Let's review answer number 2. Answer number 2 says, praise the client for aspects of the procedure done accurately. In other words, wow, great. You did this, and that correctly. Good job. And correct the client's mistake. So I like answer number 2 for this reason. 1, it praises the client, which stimulates the client to be involved in the education, but also teaches the client about the things that were performed incorrectly. In other words, in answer number 2, the nurse is providing feedback. So for now, answer number 2 could be the correct answer. Let's go to answer number 3. It says, praise the client for steps completed correctly. Very similar to answer number 2. And then it says, refer the client to home care for follow-up. Uh-oh, we have a problem here. What is the problem that we have here? The problem that we have is that you are delegating providing feedback to the patient. And if you recall, when I was talking about education and teaching the patient, I told you that you cannot delegate providing feedback to someone else when you were the one involved in the teaching process. This is extremely important. So the first part of answer number 3 is okay, praising the client. That is good. But the second half, after and, is incorrect and violates the guidelines for patient education. All right? Thank you, Miss Gisela Dueñas, for supporting our YouTube channel. Thank you very much. So answer number 3, let's eliminate it. Answer number 4 says, and this answer, a few of you selected answer number 4. Explain kindly that the procedure was performed incorrectly, and have the client repeat the procedure. I saw that a few of you guys really liked this answer, but there are several things wrong with this answer. I know that many of you like the word kindly, and it does. It sounds nice to do it in a kind way, but there is a problem. The first problem that I see in answer number 4, it generalizes and says, explain kindly that the procedure, the whole procedure, was performed incorrectly. So let's evaluate and compare answer 2 and 4. Answer 4 says the procedure, the whole procedure, was performed incorrectly. But look at answer number 2. Praise the client for aspect of the procedure, some parts of the procedure that was done accurately. Which one sounds better? If somebody's teaching you something and that person tells you, hey, good job on a few things that you did correctly, or if I tell you, everything that you did incorrectly. Which one is rude? Which one doesn't really help with the education process? Thank you, Miss Gloria Carter, for that super chat. Appreciate it. Thank you very much. Thank you, Miss Beverly Calanya, for supporting our YouTube channel. So if we compare answer number 2 and 4, number 2 sounds a little bit better. So this first part of answer number 4, I don't like it. It's very rude. And then, this is what's also wrong with answer number 4. And have the client repeat the procedure. What is the client going to fix? If me, the nurse, has not given this patient feedback. Me as the nurse didn't tell the patient, you did this wrong. Fix this part that you did wrong. So answer number 4, first, is not polite by telling the patient that the whole procedure was done incorrectly. And second, it does not provide the patient with feedback and areas that the patient needs to work on to improve. So answer number 4 is eliminated, and answer number 2 is the correct answer. All right, Miss Hannah, thank you for explaining in depth. Thank you very much. Like I said, the most important part of NCLEX preparation is to go in depth on your critical thinking and analysis. Because, like I told you, day 2 and day 3, it doesn't matter if you got it right or wrong if your critical thinking process is incorrect. Because then, when another question comes that is more difficult, you will feel lost in that question, okay? All right. Correctly said. Great job. Thank you, Hesser. Great and clear explanation. Very good. So let's go to the next question. The next question is very interesting as well. Let's repeat the same process. Comment on the comment section, your answer, why you think that's the answer, and also, as you're thinking through this question and answers, identify the answers that you are eliminating. Why? Why do you think that those answers are incorrect? So which information will be most helpful? Critical keyword. Maybe a few of them are helpful, but you're trying to find the most helpful. In teaching parents about primary prevention of foreign body aspiration. You see, this question is about prevention. What does the word prevention mean? It means that you're going to do an action in teaching that when it's done, the patient, the family, the parents, they will understand that teaching, and if they follow that teaching, is going to prevent the foreign body aspiration from occurring. What do you think is the answer after I realigned the focus of the question? I see some of you are responding answer 3. Some of you are selecting answer 4. So let's read all the answers. Signs and symptoms of foreign body aspiration, therapeutic management of foreign body aspiration, most common objects that toddlers aspirate, and risks associated with foreign body aspiration. See, this is a very interesting scenario. And as you review each answer, think, if I do this, would I prevent, or would I help the family, the parents, prevent foreign body aspiration? So answer number 1, you're telling the parents, if you see these signs and symptoms, the baby, the child has aspirated. So if you see these signs and symptoms, we have a problem. We have a foreign body aspiration. Telling the family, the parents, about signs and symptoms helps them identify if the child is going through a foreign body aspiration problem, but it does not help the parents prevent it. So answer number 1 is eliminated. Answer number 2, therapeutic management of foreign body aspiration. In other words, how to handle, how to deal, what interactions to do if there is a foreign body aspiration. This answer is telling the parents how to deal with the problem, not prevent the problem. So we eliminate answer number 2. Answer number 3, most common objects that toddler aspirate. In other words, you tell the parents, be careful with small toys. Be careful with small pieces of little cars or toys that the child can aspirate on. So if you're careful with this, you will be teaching the parents things to do to prevent the foreign body aspiration. So answer number 3 makes a whole lot of sense. Answer number 3 is an excellent teaching to prevent foreign body aspiration. Answer number 4, risks associated with foreign body aspiration. In other words, you're teaching the parents that if a foreign body aspiration occurs, this is the risk or complications associated with a foreign body aspiration. Answer number 4 does not help prevent. So the correct answer is answer number 3. So this is just 2 examples of how to deal with teaching or style of questions in the NCLEX that you could see that deals with teaching. All right? Let me see, this camera is acting up. It's blurry. Okay, me dice Betty Beatriz Delgado, thank you for supporting our YouTube channel. Arwa says primary is before the problems occur. Excellent. It's called primary prevention. Remember, there are 3 levels: primary prevention, secondary prevention, and tertiary prevention. Okay? But that is a topic for another day, a little bit more in depth into healthcare and promotion and prevention. All right, good job. Good job to everyone that answered this question correctly. Very nice. All right, so I see about 375 nursing students here connected in our YouTube channel. So remember, I've been asking every day, and you guys been doing a great job helping me with this. Go ahead and like this video now. Help me that other students can hear and see this explanation, this day 4 of our 7-day training. So go ahead and hit that like button so other students can also see this video. Help me with that. Also, go ahead and share this video with other nursing students. Invite other students to our Telegram group. If you do not have access to our Telegram group, I will ask our advisor to share the Telegram here in the comment section in YouTube, so you can click on it and join our Telegram group, where every day I'm going to post information. We're sharing a lot of information. I will be sharing videos there as well after our 7-day training. So it is very important that you are involved the whole way with this NCLEX preparation. So advisor, if you can comment on the section here, comment section, and put the the link. Darlene says, Profe, I don't like it. I love it. I'm gonna have to talk to YouTube to see if they can put a love it icon. Thank you very much. So show your gratitude by liking it, liking the video, and really help NCLEX Crusade International help many other students that need help. Okay? All right. So do you want to practice more questions? Do you want to practice questions that deals with psychosocial integrity? How about therapeutic communication, NCLEX style questions? Do you want to practice some questions like that? Comment on the section. Yes, Professor, let's practice more questions. Miss Lourdes, my English betrayed me with this question. I couldn't understand. No problem, Lourdes. You will learn. Trust me. I was in your shoes 27 years ago. I came from Cuba in 1996, 27 years ago. And I understand the frustration when you don't understand the language. Even after 27 years, I still struggle sometimes communicating or trying to say things one way. I get the Spanish and the English all mixed up in my mind. So I really, really understand what some of you are experiencing. And others that are connected here, maybe English is your first language. And you don't have that problem, you don't have that difficulty. And you know what? That's great. You have an excellent chance to passing this NCLEX. Thank you, Miss Lois Brown, for that super sticker. Thank you. That little bird is on fire. Miss Freya, comprehension is the key, and that is my problem. It will get better. It gets better with practice and listening and watching these videos over and over. Dalisi says, Sarah style questions. Yes, we will practice some select all that apply style questions. I'm going to try to do that probably day 6. We're going to practice some select all that apply. Thank you, Miss Benita Violette. Thank you once again. You've been supporting, donating for our channel every single day. I appreciate it. Thanks for your time and effort on being here with us. Ashu Niajan, God will help us pass this NCLEX. In Jesus' name, yes, amen. Let's go for that. You can do it. You can fulfill your dream. If I did it, so can you. We've had thousands of students pass the NCLEX. Now, many of them are nurse practitioners. If they did it, so can you. There's nothing different. Maybe some of you have harder obstacles, or it might take you a little bit longer, but you will do it. If you believe that you can do it, you will do it. You will find a way to do it. Okay? Thank you, Elizabeth Grignon. Thank you for supporting our YouTube channel. Areli says, click the like icon. There are 377 watching and only 177 likes. I cannot see it live when I'm here in the live YouTube. On mine, it shows 5, but I know that many of you have liked it already, and it's a matter of just paying forward. You know, it helps me, helps you. So I really appreciate every nursing student that does it. If you watch this video and you like it, hit the like button. But if you don't do it, it's okay. You know, I mean, I'm not gonna get upset. I'm not gonna say, oh, you're not liking my videos, I'm not gonna give more videos. No, I will continue to teach, because teaching is what I love. Teaching is my passion. I enjoy this. I can be doing this all day long, whether somebody likes the video or not. But it makes me feel good when I see students liking the video, when I see students sharing the videos, and most importantly, it helps the YouTube channel, okay? So let's go to psychosocial integrity. Psychosocial integrity, the nurse provides and directs care, nursing care, that promotes and supports the emotional, mental, and social well-being of the clients experiencing stressful events, as well as clients with acute or chronic mental illness. So it is very, very interesting, this concept of psychosocial integrity. Monisha, EKG, please. Yes, so this is my goal. This is what I want to do, okay? And after we're done with the YouTube live and the 7-day training, in our Telegram group, I will ask the whole group of several topics that you guys want to learn. And then I will pick the 7 most commonly picked topics, and I will do another 7-day training covering each one of those topics. I don't know what it's going to be yet. I will let everyone know in our Telegram group once it's done, and as soon as I got that ready, after I take a short vacation, I will do another 7-day training to help all of you guys out, and I will let you know the beginning date of that. So, but I don't have that information at this moment, okay? Thank you, Caridad Gonzalez. Thank you for supporting our YouTube channel. All right, so what are some subtopics that are included in psychosocial integrity? Assess clients for abuse or neglect and intervene as appropriate. Incorporate behavioral management techniques. Assess client ability to cope with life changes and provide support. Assess the potential for violence. Provide end-of-life care. Provide care and education for acute and chronic psychosocial health issues. Provide care for the client experiencing visual, auditory, or cognitive distortions. Use therapeutic communication techniques and promote a therapeutic environment. Remember, you can find this information on NCSBN 2019, I believe. I forgot the year. The test plan, the RN test plan. You can find this information that I'm sharing with you. Okay? All right, so when it comes to the psychosocial integrity category, many of the questions, many of the questions are related to therapeutic communication. And I have developed a strategy that I like to use with therapeutic communication style question. And basically, when I see a question that has to do with communication or therapeutic communication, what I try to do is that I look at each answer and I try to identify if the answer is therapeutic or non-therapeutic. But in order to do that, you need to know first what is a therapeutic answer and what is not a therapeutic answer, or what is a non-therapeutic answer. So I want to spend the next few minutes talking about the difference between therapeutic techniques and non-therapeutic techniques. So, professor, if I'm looking at a question, at a communication question, how do I know if an answer is therapeutic? And I will give you 5 keywords that tells you the answer could be therapeutic. 1, if the answer deals with safety. If the focus of the answer has to do with patient's safety, that is therapeutic. Feelings. If it talks about the patient's feelings, that is therapeutic. If it talks or through the question, the nurse validates the patient's problem or patient's condition, that is therapeutic. Restating means saying something the patient said to you first. The patient tells you, I have a terrible headache. You tell the patient, are you telling me you have a headache? It's a simple question, but it's therapeutic. Why? When I tell my patient exactly the same thing, or I paraphrase what the patient just told me, shows the patient that I was listening to him or her, and that is therapeutic. Summarizing is also therapeutic. In other words, if at the end of the conversation I tell my patient, so let me see if I understood this. You have this, and that problem. That is therapeutic. Now, what are keywords that tells you the answer is probably not therapeutic? We have keywords such as don't worry. If you tell a patient, don't worry, everything will be fine, that is unrealistic and not therapeutic. When the answer states why are you doing this? Why haven't you taken your medication? Why this? Why that? Why is not therapeutic? Because the patient will feel judged. For example, and only as an example on this live streaming, I'm not pushing anybody, but using it as an example. If I tell you, now really tell me, why haven't you liked this video? Why? Why you didn't click the like button? You're gonna feel judged. You're gonna feel like I'm punishing you. And when you tell a patient why, the patient's focus will be, I'm being judged, I'm doing something wrong. And that is not going to stimulate communication. And remember, the whole purpose of a therapeutic communication is for the communication between the nurse and the patient to flow. The more information the nurse can get about the patient's condition, the better. Another style of answers that are incorrect are authoritarian answers. What is an authoritarian answer? When I say, I'm the nurse, vital signs are taken every day at 8 o'clock in the morning. Period. There's no break in between. That is the rule. That is authoritarian. However, I will tell you, there are scenarios where an authoritarian answer could be correct. An example of that is a psychiatric patient that is trying to manipulate you or trying to manipulate the environment. In those scenarios, you can be authoritarian and it is correct. Another scenario is if the patient is putting his or her life at risk. If there is a safety compromise, you could be authoritarian in order to promote patient's safety. Another example of non-therapeutic responses are responses that focus on the nurse. Oh, it happened to me once. My mother also had that problem. And my father also gets morning headaches every day. That is incorrect. It's non-therapeutic because the statement is focusing on me rather the patient's problem. Remember, the patient's problem is more important. Another example of non-therapeutic responses: giving advice and judging. We are not there to give advice. We don't talk about opinions. We don't give opinions about what we believe is correct or incorrect. If I were you, I will take the medication right now because it is the best thing for you. That is your opinion. We don't give opinion, we give facts. Okay? And be very careful to judge the patient. I don't really understand why you're not taking your medication. Apparently, you don't want to get better. If you don't take your medication, you don't want to get better. That is a judging statement. And judging statements are non-therapeutic and it's going to break the flow in communication. So, let's practice one question. Here it is. Read it. Identify the key factors of an NCLEX question. Recognize that this is a therapeutic communication scenario and try to use everything that I just mentioned about what makes a statement therapeutic or non-therapeutic. And as you start reviewing this scenario and the answers, you are going to start thinking about a lot of things that I just mentioned. Now, recognize that just by watching this live YouTube might not be sufficient. You might have to go back and replay the video and listen to it again. That way you can take notes. Remember, study this presentation. Study day 1, day 2, day 3. A lot of mistakes that I see students make is they watch the live video and they never see the video again. That's not what you're supposed to be doing here. You need to go back, get a pen, a paper, and take notes. What did the professor say here? What strategy did he use here? What did he say about therapeutic communication? That is extremely important. So I see some of you are responding 3, some of you are responding 4. All right. Very good. And Antonieta, excellent help for everyone. Imagine taking the course with NCLEX Crusade is the best option. Blessings to the Crusade family. Thank you, Antonieta. Thank you for your comment. God Love says definitely number 4. All right. Some of you said number 2. Okay. Let's see. A client is diagnosed with depression. A client with a diagnosis of depression, who has attempted suicide says to the nurse, I should have died. I have always been a failure. Nothing is ever right for me, or nothing ever goes right for me. Which response by the nurse demonstrates therapeutic communication. Whenever they put a patient statement in quotes, that is important. Make sure you pay attention to that. And what did the patient say in quote? I should have died, safety, and I have always been a failure. I don't know if you really paid attention to that or not. Then the patient says, nothing goes ever right for me. Nothing ever goes right for me. That is another statement. What is the best response? Number 1, here comes the opinion. Me, the nurse, is telling the patient, you have everything to live for. You have reasons to be happy. You should be happy, right? Similar answers. You have everything to live for is my opinion. Does that answer encourage communication? No. So answer number 1 is eliminated. Answer number 2, that is very easy. Why? Why do you see yourself as a failure? So answer number 2 uses the word why, and we've learned that that's not therapeutic. Now, we are going to eliminate answer number 2. Answer number 3. Feeling like this is all part of being depressed. What you're telling the patient in answer number 3 is that feeling like that is normal. It's part of being depressed. It's like saying, it's not important because this is normal. That does not stimulate or encourages communication. And on top of that is an opinion that I am giving as a nurse. So 3 is not the answer. Now, answer number 4. You have been feeling like a failure for a while. And look at this. Feeling like a failure, and while means or represents time. Look at the patient statement. I have always is time. I have always been a failure. So answer number 4 talks about being a failure, talks about time, and is a reflection of what the patient just told you. This is called a restatement or restating what the patient said. Answer number 4 is the correct answer. Now, I see some of you commenting on the comment section about open-ended question and closed-ended questions. Let's talk a little bit about that. I wasn't planning to talk about that in this YouTube live, but hey, You guys have done a great job. So I'll be nice. So, Professor, what is the best answer if the question that the nurse is asking is open-ended question or closed? What is the best? The answer is depends. Depends on what, Professor? Well, let's begin with what is an open and what is a closed-ended question. So an open-ended question is a question that allows the patient to communicate, to give an explanation. While a closed-ended question, when you ask a closed-ended question, the answer is yes or no. For example, if I ask, let's say, Ellie, if I ask Ellie, do you like this training? That is a closed-ended question because Ellie's response will be yes or no. That is a closed-ended question. But if I ask David, what have you liked the most about our 7-day training? Well, Professor, I love that first day. You really taught me to understand the NCLEX world, but oh my God, the third day was awesome. To learn the categories, that is awesome. And today, even better. Today, I'm really learning about therapeutic communication. You see, I asked a question that is open to communication, and David has the opportunity to express feelings. So, usually, open-ended question is therapeutic or more therapeutic than closed-ended questions. However, you cannot generalize. Why? Why am I telling you that it depends? Look at this scenario. Answer number 4 is a closed-ended question. And it is the right answer. So when it's a closed-ended question, therapeutic, simple. If it deals with safety, if it restates, like in this scenario, if that statement helps you validate something clear and concrete, that could be therapeutic. So I cannot generalize and say, no, closed-ended question is not therapeutic, because it's not true. I have seen and have seen videos on YouTube that talk about therapeutic communication from other mentors. And I have heard them making the mistake of teaching and saying that a closed-ended question is non-therapeutic, and that is not true. Because there are scenarios where a closed-ended question is therapeutic, like the ones I just mentioned. Okay? Modupe says, I get it, Prof. 4 is validating the patient's feeling. Correct. So answer number 4 is a closed-ended question, but it validates feelings, restates what the patient is saying in the stem of the question. Siler Vanna, how about for suicide? Is a closed-ended question better? Absolutely. With suicide, you do not want an open-ended question. You want a closed-ended question. Do you want to kill yourself? Do you have a plan to kill yourself? Okay? That is the most beneficial question to ask, because you need to find out. All right? Harper Ramsey, Professor, you break it down to the bones. Thank you, sir. Thank you very much. All right, let's practice another question. So this question says, a nurse is communicating with a client on an inpatient psychiatric unit. So now the scenario changed a little bit. We're talking about a psychiatric unit, inpatient. Now, the client moves closer and invades the nurse's personal space, making the nurse uncomfortable. In other words, the patient is like right here, very close to the nurse, and the nurse is like, okay, I'm uncomfortable here. This feels weird. So what is an appropriate nursing intervention? Number one says, the nurse ignores this behavior because it shows the client is progressing. So I ask you this question. If you feel invade, your personal space is invaded, you're talking about a psychiatric patient in a psychiatric unit, your safety is compromised. Should you ignore this situation when your safety is compromised, when your personal space is being compromised by a psychiatric patient? No. You never ignore this situation. So answer number one, bye-bye. Eliminate it. So answer number two says, the nurse expresses a sense of discomfort and, important word, limits behaviors. So let's compare answer number one and two. Answer number one ignores the behavior. Answer number two stops the behavior. No, this is wrong. I'm not comfortable. I don't like it. You need to stop it. So answer one and two is opposite to each other. So maybe the correct answer is between them two. We know that one is not the answer. Maybe two is the answer. I see some of you selecting answer number four. Maybe, maybe not. Let's see. Answer number three. The nurse understands that the client requires various amount of personal space and accepts the behavior. What is the relationship between 1 and 3? Exactly the same. Neither 1 or 3 does anything with this problem. And the nurse's personal space is being invaded, the nurse is uncomfortable, and safety of the staff is compromised. We know that doing nothing is not the answer. Answer 1 and 3 are similar, and 2 is opposite to 1 and 3. That is a strategy. Whenever you see answers that oppose each other, usually the right answer it is in between them. Not always, because we can never generalize, but most of the time. Answer number 4. The nurse confronts the client and states that he or she will be secluded if behavior continues. So answer number 4 also kind of stops the behavior. So we say that 2 and 4 are similar in the sense that at least in answer 2 and 4, the nurse is doing something about the problem. Now, what is the best approach? And I want you to look at these words. Express and confronts. What is better in communication? What is more therapeutic? To express feelings, to express sense of discomfort, to express about the problem, or confront? Usually the word confront has a negative connotation to it. It's better to express than to confront. So in that sense, I like 2 better. Number 2, the nurse limits the behavior. In number 4, the nurse threatens the patient. If you don't stop, I will put you in seclusion. That is a threat. We do not threat patients. That is considered assault. And it's very important for you to know the difference between assault, battery, and false imprisonment. If you don't know about that, maybe we can talk about that in another video. So, answer number 4, we can eliminate it. The correct answer is answer number 2. That is the correct answer. Now, Professor, timeout. Didn't we talk about authoritarian questions or answers? Didn't you say that authoritarian answers was non-therapeutic? Answer number 2 is kind of authoritarian, because you're saying, do this, stop, I don't like what's going on. So yes, this is an authoritarian answer, but this is the rule of exception, or exception of the rule, because in this scenario your safety is compromised. In those scenarios, it is okay to act in an authoritarian way. It's very important for you to understand this. All right, so what do you think? What do you think about that last question? Did you like it? Did you enjoy that question? Let's practice another question. Here's the next question. When a client experiences a panic attack, which correctly written outcome takes priority? So there are 2 important focus in this question. 1, an outcome that is written correctly, and 2, that has the priority. So the answer that I'm looking for, I have to think of prioritization, and also that the answer, the outcome, is written the right way. So what do I know about outcomes? 2 important factors about outcomes in nursing care. The first is that it has to be measurable. It needs a time frame. So that is important. It needs to have a measurable, objective data, and it needs to have a time frame. So if the answer is not measurable and it doesn't have a time frame, then it's probably incorrect. But then also you have to think of prioritization. So number 1 says the client will remain safe. So safety means the patient will be taken care of, no harm will be caused. Whether maybe I got the patient in one-to-one observation, or if I need to put the patient on restraints, if it's being violent, whatever the situation is, whatever the appropriate nursing action that I can take that makes the patient safe, that will be a priority. And also, it needs to have a time frame, and it says throughout the duration of the panic attack. There is a time frame. Through the duration of the panic attack, I will keep my patient safe. It has the 2 factors. And it is a priority because safety is a priority. So for now, I like answer number 1. Let's see answer number 2. The client verbalized an anxiety level of less than 2 out of 10. So let's talk about this one. It has an objectable measure data 2 out of 10. That is measurable, but there is a problem. It doesn't have a time frame. And also, it's unrealistic because a patient that has a panic attack is the highest level of anxiety, and you cannot expect an anxiety level of 2 out of 10. This does not make sense. So answer number 2 I can eliminate for that reason. Answer number 3. The client will use learned coping mechanisms to decrease anxiety. 2 things. It's not measurable, there's no time frame, and it is not realistic. Why not? The patient experiences a panic attack. The reason why a patient experiences a panic attack is because whatever learning or coping mechanisms that they have is not working, or they're not using them. Otherwise, they would not reach to the panic attack level of anxiety. So answer number 3 does not make sense. Answer number 4. The client will verbalize the positive effect of exercise by day 2. A positive effect is a desired outcome in the plan of care of the patient. This contains a measurable or time frame. However, it is not realistic. So we have several answers that are unrealistic, 2, 3, and 4. But the most important key factor to make answer number 1 the correct answer is it has a time frame and it deals with safety, which is the priority. All right, now I want to open this last section for you to ask me questions about NCLEX preparation. I want to open a few minutes. We can, communicate. You can communicate via the chat. I will read your comments and I will respond the best I can in whatever I can help you with. Make sure, I see a lot of you guys are still not subscribed to our YouTube channel. Remember, subscribe to the YouTube channel and activate the bell so you get the notifications, and also make sure you have joined our Telegram group. I have put the link for the Telegram group in several areas. I put it in the description section, in the comment section, and also in the description of the playlist, and also in other videos. So find the link to the Telegram group, join it, and come and be part of our family. So, tell me, I want to talk to you about whatever question that you have for me about NCLEX preparation. So I open this opportunity for you to ask questions and I will answer the best I can. So, free time, ask questions. What can I help you with? So, Sheila Mew, do you have a live review? Right now, for English-speaking nurses, I do not have a live review at this moment. For nurses that speak Spanish, and I know some of you speak Spanish, I do have several courses for you to attend, but only if you speak Spanish and English. For the English community, remember this is a new YouTube channel. I am developing several trainings, but they will not be done now. What I plan to do in the near future, after we're done with our 7-day training, I will open some live classes on Zoom. Something quick where we can be 3 hours answering questions together, where you can communicate with me back and forward. When the training is done, I will give information about that. But very important, do not pay anybody now. I'm not selling anything right now. Do not send money to anybody via Zelle or anything like that. I talked about this yesterday. There's a lot of scammers out there saying that they are selling a course on my behalf. I have not given anybody permission to sell any course, nor I'm selling any course right now. So that is important so you don't fall into one of these scams, okay? Let me see. Ibros, the question that has to do with follow-up, they are priority questions. So once you learn how to prioritize, you will really develop the skill to answer follow-up types of question and any other prioritization style question. We're gonna get there in our training. Is there any change on the NCLEX after April? No. The change on the NCLEX is April 2023, next year, not this April. No changes on the NCLEX until April 2023. Ashu Najan, more info on measurable and unmeasurable data. I talked about that in day one. I explained measurable data or unmeasurable data. Subjective or objective, same thing. Areli Montero, what suggestions do you have for test anxiety? Well, the first thing that you can do for test anxiety is believe that you can do it. Now, this is easier said than done. You don't do it the day of the exam. You develop it prior to your day of the exam. So the more you practice, the more you focus, the more you learn, you will develop that control. Remember, if it is non-pathologic, if you don't have a legit, a high anxiety level, a medical condition, okay? But most of us can control our anxiety levels. Use a lot of breathing exercise. Whenever you feel that you're getting very anxious, your breathing controls everything. Like if you're getting anxious and you're like, you start breathing super fast, that's gonna cause for you to be more anxious. So slow your breath. Think, 1, 2, work on your breathing, and that will help with anxiety. But prove yourself in training that you are getting better and that you can pass this test. I have exams on April 19, 2022. Can I start for now? Enough time until April 19? Do you mean if you're talking about a course? It depends if you're joining the Latino version. If it's the English version, I don't have anything right now. I might do some practice sessions before that time. Maybe 1 or 2. You will be able to join us, but it depends. Hey Lina, I'm 18 years of experience like a nurse, and this is a little difficult when I try to do review for the NCLEX exam. What I need to do? Nurses that have experience on the field, they struggle a little bit more with NCLEX question because they try to answer NCLEX question based on the real world. And the problem is that you have to respond the way the NCLEX want you to respond, not use real life scenario. An example of that, when it comes to delegation, a lot of things are done incorrectly on the field that NCLEX does not accept as delegation guidelines. So you have to really be careful with that and not use real life experience to answer NCLEX style question. When taking the NCLEX exam, does the question comes randomly from any part? And how many questions are there? And what is the time frame for the exam? The time frame, I believe, is 5 hours now, 145 questions. And the questions are randomly from a huge Q bank. Each nursing student will have different questions. Nobody gets the same question. And the factors to select an NCLEX question, remember that it is a computer adaptive test. So there's two guidelines to select an NCLEX question. One is, what is the category that question is going to represent? Physiological, management of care, psychosocial, and the level of difficulty, below, near, or above the passing standard. All right, thank you, Professor. What's the channel for the Spanish-speaking nurses? NCLEX Crusade without the international. So everything I put on NCLEX Crusade International is in English, no Spanish. Everything I put in NCLEX Crusade without the international, that is in Spanish. So if you want to see Spanish video, go to NCLEX Crusade, no international. Okay? What is the best Q bank to practice? Harper and Mikael. I believe Ewart or Kaplan. One of them are the best. I like Kaplan better. Professor, what are some of the questions on case studies? Nancy, do not worry about case studies right now. That's going to be on April 2023. Let's not get into that because everybody else is going to get confused and it's irrelevant at this point in time. Okay? I don't want to confuse you. Interdisciplinary, that is management of care. Okay? It is covered in management of care, a little bit in leadership. Saunders talks a little bit about that, but not much. So if you're listening to this video or this live and you are a Spanish speaking nurse, okay, and you want to join the Spanish Academy, okay, there are several courses in that academy because I've been working with Spanish nurses for 4 years. So I have developed a lot of things. If that's you and you want to call the academy, call this number 352-565-4253. Let me make sure I got the number correctly. So 352-565-4253. Okay? If my advisor can help me with that, if you can put the number on the chat, please. I haven't used that number in a while. I don't even remember. Now, if it's not for the Spanish Academy, don't call that number because the representative that I have to deal with that academy speaks Spanish. Okay? Professor, do review the NCLEX report prior to starting the program or doing the program to personalize my new study plan if I were to start your program. If Areli Montero, if you're starting the Spanish program, you could do both, because in the program I have assessment tests also, and it's going to help you identify your areas of weaknesses. Call the academy number, and she will help you. Okay. Jingo in the Palace says, Professor, I used you word. None of that was accurate and it was vague. When I took the exam, it was different type of questions. That is why I say I prefer the Kaplan, because the style of questions for the Kaplan is higher thinking style questions. However, I've had a lot of nurses that have used the U world and they've done very good, but they've used your word and my teachings. So I'm pretty sure that made the difference. And also, your word I think is more beneficial to nurses that are weak in content. So if your weakness is not content, it's more critical thinking, then Kaplan will be the way to go. I have the previous version of Sanders, can still use this book for the NCLEX. You should be using Sanders 8th edition. It's the most current edition, and you should be using that. Okay, well guys, I'm gonna finish this live right now. I hope you're ready for day 5 at 5 p.m. tomorrow, sharp and ready to practice. We're gonna do a lot of things tomorrow. You're gonna really enjoy tomorrow. We're gonna talk about critical thinking, prioritization strategies. We're gonna practice priority questions, so it's gonna be very beneficial for you. So be here on time. If you cannot see it live, watch the replay or recorded version of this live. And I hope the best for each one of you. Remember, if you are an English-speaking nurse, I do not have a course at this moment. Do not buy a course from anybody saying that they're from NCLEX Crusade International. Like I was told yesterday, charging like $600 or whatever like that. Do not fall into that scam once again. I have repeated this several times because it really hurts me to see one of you guys fall under one of those scams and lose your hard earned money. Okay? Thank you for being here. Thank you for trusting me. Thank you for helping this YouTube channel grow. And make sure that you are subscribed, that you are liking our videos, comment on the videos, your critical thinking, but most important, review these videos over again. Study them. Do not use this live as a movie. It's not a movie. There's better movies out there to watch than an NCLEX training. Use this as a training or studying guide to help you with your NCLEX preparation. And I know a 7-day training cannot cover everything. I know that. I know no 7-day or 15 or 20-day, because it takes time to develop your critical thinking, to really prepare for the NCLEX. I'm doing the best I can with the time that I have. I don't have a whole lot of time. I'm very busy, but I want to do this for you guys. I see the frustration in many of you. And trust me, I will do something to help you guys out. We will meet somehow on a Zoom live. I will prepare something for you guys to help you, for those who have the test nearby. But until then, focus on this training. Let's work on the next training. And if you are somewhere around the world that you cannot spend money on a NCLEX preparation training, I know that there's people out there that don't have money to spend on an NCLEX preparation training. Not me, not anybody. If that's you, I'm here to help you. I will continue to create content in my free YouTube channel. So I will not leave you guys abandoned. Trust me on that. I've been helping a lot of Latino nurses for 4 years. Okay? I have not left any one of them behind. This is my word to you. If God gives me health and I can continue to work and wake up every morning and prepare something for you guys to help you, if I have to do it, even if it's free here on YouTube, I will do it. And for those who want something else, maybe want a little bit more hands-on in a Zoom training or something like that, I will create something for you as well. Thank you very much. God bless you all. See you tomorrow at 5 on an excellent training day where you will learn about prioritization. Bye-bye. God bless you.